The struggle for single-payer health care in the country and in California has been getting increasing coverage lately. California recently has been the front line in that effort because it has been the politicians there and organizing groups there have been working for a single-payer initiative in our largest state economy. Here to discuss that with us now is one of the leading figures in that effort. Michael Lighty is the Policy Director for National Nurses United, and National Nurses United has been very, very active in this effort. So first of all, Michael, thanks for joining us.
Thank you, Richard. Great to see you.
Great to see you. And okay, so first of all, for the benefit of our viewers who might not know the latest, where do we stand with the single-payer bill that I believe passed the state Senate?
That's right. It passed the state Senate on June 1st. Richard, 2314 was the vote. It's now stalled in the Assembly, unfortunately. That's the other house in the California legislature. The Speaker, Anthony Rendon, has taken it upon himself to hold the bill for no good reason. And we were in the process of working on policy issues, putting in the financing plan, and he just took it aside and stalled it. So right now we're doing everything we can to get that bill released and for the Speaker to stop holding our healthcare hostage.
Now, Michael, I've been trying to follow this pretty closely. Anthony Rendon is a Democrat. Democrats have a majority in the Assembly. And I read Mr. Rendon's statement on his action with great care. And I must say, I found it baffling, to say the least, because he seemed to be saying that because this measure requires additional discussion, I'm holding it back and preventing discussion. That was very difficult for me to grasp. And he also seemed to be saying that because Donald Trump and the Republicans are proposing something much worse on a national level, I don't think this is the time to propose something much better than what we have today, which I also found confusing. So let's start with Mr. Rendon's logic. Does it make sense to you? Are you able to decipher something I can't?
No, I think you're right, Richard. I mean, there is no logic to it. It's illogical. If you're concerned that the bill is incomplete and you stop the process to complete it, that's just disingenuous. If you're concerned about what the GOP is doing to people's health care and you say, well, we're not going to do anything in California to fill the gap or take charge of our own destiny in healthcare, then there's no logic to that either. So this is the fundamental problem. There's a fierce urgency of now. People have high anxiety about what the GOP is doing. California, not just a majority, but a 2/3 majority in the Assembly and the Senate and a Democratic governor. So Californians aren't going to sit back and say, oh yeah, Democrats, fine, let the GOP do whatever you want to our healthcare. That ain't going to fly. They're going to have to step up and resolve this issue in a way that eliminates the anxiety people legitimately feel about what's going on with healthcare and establish real guaranteed healthcare for all. That's the promise of SB 562 that the Speaker has stalled.
Now, let me tell you what I intuit from the politics of this, which was what you were just alluding to, and let me know what you think, Michael Lighty, because it seems to me that the Democrats' defensive posture, strictly defensive, about the Affordable Care Act, which boils down to let's protect the ACA against the AHCA, is a bit arcane for many voters, whereas if you say the Republicans are trying to make it impossible to get health insurance, we are fighting to guarantee that you can get health care, would be something that people can grasp.
Yes, you're absolutely right. I mean, this is the fallacy that basically we're looking both at the ACA and the AHCA as the tax subsidy of private health insurance. Mm-hmm. The private health insurers are a failed business. They basically depend upon taxpayers for their revenue and profits. You eliminate the tax subsidies and it's not viable. And you're exactly right, Richard. The difference is universal health insurance at the mercy of the insurance companies who are in business to deny people care in order to make profits. That's what they do. On the one hand, that's insurance, and on the other hand, there's guaranteed health care as a human right. And that's what SB 562 does. That's what Medicare for All would do at the federal level. We improve Medicare. We can expand it to everyone, improve benefits. That's what SB 562 does. And I think that's exactly right. You cannot beat the current debate or win the current debate in Washington with nothing. You've got to have an alternative. And people are tired of high deductibles. In California, 36% of people have a deductible higher than $2,000 under the ACA. That's not going to fly. And so if we get rid of those insurance company premiums, deductibles, and copays, that's how we can guarantee health care. You can't have entities in healthcare whose business model depends upon denying healthcare and claim that's a path to universal coverage.
Now, there's an attitude when people, frankly, like us, talk about the idea of Medicare for All. There's a posture that seems to get struck in certain Democratic circles, broadly speaking, that it strikes me as one of slightly eye-rolling condescension. Oh yeah, but you don't get that it's hard. In fact, it's so hard as to be impossible. Now, it seems to me that it's, while the challenges are certainly there and certainly significant, it certainly seems to me on a national level, for example, that the challenges of turning Medicare into Medicare for All are less than the challenges were of turning nothing into Medicare for everybody over 65. So if we've already jumped hurdle number one, it seems to me the remaining hurdles should be surmountable. Am I oversimplifying?
You're not. You're exactly right, Richard. I mean, the reality is all we have to do is extend Medicare eligibility to birth and adopt the benefits that are actually in Medicaid, because you include things like dental and vision that are not part of Medicare, obviously pediatrics that are not part of Medicare. It's very straightforward. You can finance it with a what we call a Robin Hood tax on Wall Street and a modest increase in premium, payroll premiums that we currently pay to Medicare. And you'd have it. You'd have the system. You'd have everybody in, nobody out. And so that really, that's the irony, is that every provider in the country accepts Medicare. Medicare has relationships with literally the entire healthcare systems in every state, every hospital, every clinic, every doctor. So we could essentially adopt Medicare for All on an improved basis, and we would easily cover everybody. And that's what SB 562 does. It essentially says we're going to pay Medicare rates, adjust where we need to. We're going to cover everybody with comprehensive benefits beyond what Medicare currently provides. And we're going to cover those undocumented workers who, of course, are paying into the system but not getting coverage. So it is literally everybody in, nobody out. And that's what we could do at the federal level so easily. It would take about, I think, a couple pages of legislation.
And again, we're talking with Michael Lighty, Policy Director of National Nurses United. Another point that keeps getting made, both in California, in the California debate and the national debate, people keep saying, well, you know, again, with sometimes accompanied by the same eye-rolling kind of posture, well, good luck trying to convince people to pay that much more in taxes. Well, it seems to me, I've looked at some of the numbers nationally, it seems to me if you go out to people and say, you will now pay less for health care that will give you much more, thousands of dollars less in the case of most middle-class households, that doesn't strike me as a hard sell. That strikes me as an easy sell. Wait, you're going to give me something better for much less money, and I'm supposed to be upset just because it's the government doing it? I don't think so. I'll take the $6,000 a year or whatever it comes. I can use that $6,000 a year. Am I missing something there?
No, you're not. You're exactly right. I mean, once you replace insurance company premiums, deductibles, and copays with public financing, we can literally get more and pay less. That's true. People say it's pie in the sky because government has disappointed us over and over again, primarily because it's captive of industries like healthcare. Angus Deaton, who's a Nobel Prize winning economist, said that actually healthcare is the biggest example of crony capitalism. It's a driver of inequality. It's what is at the heart of the problem between government and the industries it regulates. And so the best solution is to put the financing in the hands of the public entity like Medicare. We did that under SB 562. We were able to save middle-class families 9% of total income. Imagine, Richard, getting a 9% raise and comprehensive benefits, including all medical, dental, vision, with no deductibles or copays. It is literally possible because of the nefarious role that the insurance companies play. And when you get rid of them, then new possibilities open up for comprehensive benefits, provider choice, real choice of any doctor, and really having doctors and nurses in charge of healthcare. All that's possible if we're able to imagine, really, a system where guaranteed healthcare and healthcare as a human right is the foundation for the system.
Now let's talk, there are a couple wrinkles in California, Michael Lighty, and one of them is apparently the budgetary constraints that come along. You can't seek new revenue without a ballot initiative or something like that. This is one of the objections that's been raised. It still doesn't explain to me why this shouldn't be debated in the Assembly, but what are your thoughts on that?
Well, to raise taxes in California, it does take a 2/3 vote of the legislature and a signature of the governor, or a ballot initiative approved by a majority of the voters. So the Democrats have a 2/3 majority in the Assembly and the Senate, and of course there's a Democratic governor in Jerry Brown. So they have the constituency and the membership to do this. Healthcare for all on a single payer basis, what we call Medicare for all, polls at 70%, SB 562, 70% support in California, 58% of support after people hear the countervailing arguments. So there are constraints, but if the Democrats hold the legislative majorities necessary to pass it, then they should do so. And when they say they support universal health care or single payer, they need to say, and we want to eliminate the insurance company premiums, deductibles, and copays. Unless they're willing to do that, they can't really guarantee health care. So there are constraints within the California system, but it's no excuse for the legislature not to legislate. So these people are tired of these representatives not doing what they're elected to do. So debate it out, finish the policy, vote on the bill, and then if we need to do more, we'll do more. But the point is, these folks need to be accountable to their constituents who are suffering.
So how do you see this playing out in California? Obviously, on the national stage, we're going to all keep fighting for this. How do you see this playing out now in California?
Well, we're not giving up. The speaker can, at any time, he's the speaker, he can change the rules and move the bill. So we expect him to do so. During this next week or so, we're still in a window where under the regular rules, we can move the bill. So we're demanding that. We're going to be at a town hall, Speaker Rendon's district on Saturday. We're going to be up in Sacramento when the Assembly Health Committee would have heard our bill, SB 562, and we'll be engaging in a rally then. And then beyond that, we're going to convene our Healthy California campaign committee. The legislature goes on recess on July 21st, and we're going to figure out how to move the bill. But we're not going away. The nurses in California aren't giving up on their patients, and they're not giving up on winning guaranteed health care. So it's a fight that if Speaker Rendon thinks is going to get easy, he's wrong. If he thinks he's protecting so-called business Democrats who will basically take contributions from the healthcare industry, he's not protecting them. And all of this, by way of public education and exposure, we believe is going to hold the legislators accountable.
Well, I hope that you guys are successful, of course, and I hope that this process also educates more Californians about what is possible and organizes them to fight for what is possible. So with that, we'll have to leave it. But Michael Lighty, Policy Director for National Nurses United, thanks for doing this work and thanks for coming on the program.
Thank you, Richard. Really a pleasure.
Same here.